Our top story at this hour, in India, it is one channel which has always stood with the students' community and particularly on the issue of NEET. The latest on the NEET issue is that the apex court, that is the Supreme Court, has given an interim relief for resident doctors by asking the government to go ahead with the NEET PG counselling. The apex court has, however, upheld the constitutional validity of the 27% reservation for OBCs in NEET UG as well as PG. Meanwhile, the 10% EWS category will apply for this year, and the decision on the EWS quota shall be taken after a final hearing on the 3rd of March 2022. The other experts on the panel this afternoon to speak about this judgment by the Supreme Court, Dr. Edmond Fernandes, who is the founder and CEO of CHD Group. He's joining us. And also, of course, Advocate Anubha Srivastav Sahai, who is President of India White Parents Association, IWP, and someone who's been closely associated with this issue for the longest time. A very, very warm welcome to both of you. Happy New Year, although it's not so happy considering we are still in the midst of COVID. But then, hope is eternal for all of us. Dr. Edmond, do you welcome this move? You know, the apex court has now spoken. What do you think about it? Your first comment on it, Dr. Edmond.
No, I think brings respite to the student community and to the healthcare fraternity at large. What disappoints me is that, of course, we all acknowledge the fact that vox populi is vox populi, but litigants should also have the maturity to interact among themselves and try to settle it out of court. The ministry and the resident doctors could have come to a middle ground on this, and this need not have gone to the Supreme Court at all. So the lesson we all need to learn is that let us try to reduce the burden of the court and try to achieve middle ground and not wait for the Supreme Court to intervene at every juncture like a small baby trying to crib about the toys the baby would like to have.
Right. But Dr. Fernandes, you know, to play the devil's advocate, don't you think that when there are matters which involve legalese, it is better for the court to the judiciary to intervene? I mean, how would you have imagined that, you know, the resident doctors and the government could have solved it on a table?
I mean, just the same way as farmers' protest has been solved. Because when you have a larger community demanding something,
right,
as policy makers, we need to understand why are they asking what they are asking. And when majority of the community is asking for something, it's also the responsibility of an elected government to support them and oblige to the needs that is required.
Right. Dr. Fernandes, this 8 lakh category, you know, it has been a bone of contention for several people who were opposing it. This interim relief is all very well, like you said, Anubha said, Dr. Manish said, it's a welcome change. But don't you think it will come back next year also to bite us?
This would naturally be an issue that will repeatedly be talked about over coming months and possibly the next year as well. But what we need to understand while fitting in 8 lakhs as a category is whether this really makes logical sense. And are you going to build intellectual talent in the country by income generation? I am not sure, because if that was the case, we would have had a lot of people merely on income getting a lot of patents and other benefits. But if we want to progress as a country in healthcare, we need to revisit our reservation policies that build on the grounds of various determinants of education and healthcare and not merely on income alone. Whether it's 5 lakhs, whether it's 8 lakhs, whether it's 10 lakhs, that's left to the wisdom of the government to decide. But what I would propose is income should not be the sole bone of selection of how you would fit in EWS candidates.
Dr. Fernandes, I wanted to ask you, you know, that do you think that this was only done, the reservation criteria, as it were, the 10% for EWS, do you feel that it was just to see to it that, you know, that there was a political kind of, you know, intention behind it rather than empirical evidence?
Uh, whether it's a political decision or not, I would not want to dive into that. But I think the entire reservation process could have been made a bit more mature by factoring in multiple other parameters, which would definitely do justice to the intentions for which this quota is required.
Right.
During my MBBS days, I had friends who had availed their reservations and would travel in high-flying cars and BMWs and these kind of vehicles. So I'm not sure if reservation should be a permanent part of India, of modern India's future sustainability agenda, or we should genuinely try to factor in people who are deprived of resources and then help them enter the process to become doctors, to excel in life,
right,
and to build families which could have a better future.
Yeah, but Dr. Fernandes, in this case, there is caste is not being factored in. And then if you factor that in, then there are many more complications which will come into this. And I wonder if we can do away with reservation, because reservation was and is to empower those who are truly and genuinely marginalized, you know, whether it's economically or whether it is even caste-based. But that's another conversation. But what you said, you know, that when you were studying medicine, you had a lot of people who had a veiled reservation but would arrive in swanky cars. I mean, I wonder if that has changed now. Dr. Fernandes, this is going to have a major domino effect on resident doctors and also UG doctors. I mean, everything will be delayed. Do you think that delay in the academic year and the courses is going to impact the entire healthcare system, as it were?
I am more interested in the delay that they would get in terms of practical learning experiences, because what we need to understand here in the healthcare profession is about patient care.
Right.
And resident doctors, as much as they are going to read about theory, the skills they pick up over the process of 3 years into their residency is going to be critical on the kind of doctors tomorrow's India is going to produce, the kind of doctors that you and I would be treated by. So I'm really not bothered about the theoretical delays that they would go through, because that's something doctors are talented to pick up. We have this odd kind of talent to sit over the entire night and write exams the next day. So, but the learnings and lessons that a patient would teach you is something no medical textbook can replace. Whether it's learning in terms of core skills, whether it's learning in terms of empathy, whether it's learning in terms of social strata and
very well said, yes.
Kind of teachings patient would really teach
but
you.
Dr. Fernandes, for now, I think whether it's practical learning or theoretical, the interim relief by the Honorable Supreme Court is going to perhaps put the system back into order for now and give the entire nation some relief. Thanks so much for joining me on this debate.
Subscribe to our YouTube channel and press the bell icon to receive latest updates and stories.